I really wondered why in the world did they want an 80-year-old guy to come up here and speak to you experts? And I figured it out as I listened to the two panels that you need some optimism and some examples that we can get this done. Not only must we get it done, but I'm here to tell you we can get it done. I want to thank Maya and Mark for inviting me to come home to the committee. I was here at the birth, and to see the progress it's made in bringing people together really touches me. I also, more importantly, want to thank you all for launching today this Trust Fund Solutions Initiative. It gives me hope that we have a chance going forward with the initiatives I heard today to actually get something done. Lord knows we need to. And by God, our time is running out. Not a week goes by for me that I don't meet some North Carolinian who depends wholly on their Social Security check and that of their wife or husband. And that's to support their family in retirement. Sometimes it's the only retirement benefit they have, and sometimes it's the bedrock of their whole retirement plan. And the one thing they are, locked into for sure is they don't want the politicians up here to put these resources in any danger. What they don't realize is what this panel just said, is how much danger it's actually in. And at 80, you can imagine the amount of time I now spend with doctors and at hospitals. And while they're over and over, I hear other patients, particularly those who haven't been as blessed as I have been, admit they just plain couldn't survive without either Medicare or Medicaid. Yet, as you all said just a few minutes ago, politicians in both parties continue year after year to ignore the fiscal nightmare that two trust funds face as they continue year after year to simply kick the can down the road. If our elected officials continue to take this ostrich theory and just stick their heads in the ground and simply hope these financial problems go away, our Social Security retirement system will be insolvent, as you all well know, in 7 years. And by law, benefits must be cut for the typical American couple by 24%. And for that typical American cut, retiring in 2033, that cut could be $18,000 a year. Think about what that does to their life. The Medicare Hospital Trust Fund recipients face a similar crisis. For by 2032, this trust fund will be insolvent, and hospitals across the nation will face a 12% cut. Having served on the board of numerous small and large hospitals in North Carolina, I can assure you firsthand that a cut of that magnitude would mean, to what it would do to access, is just hard to imagine. What eats at my gut about all this is that we know how to save these trust funds. I mean, it's not a question of smart people like you all here not having the answers to what we should do. Back in 2010, that bipartisan commission that I co-chaired with my great friend, the former Republican Senator Al Simpson, We made recommendations that would have permanently restored solvency. Let me tell you what was in it, because it's ancient history now. Our Social Security plan slowed benefit growth for the highest earners, so not a new idea. We gradually raised the retirement age for those who could work longer. I can remember telling people, I've never known a smarter politician than Roosevelt. When he created Social Security, life expectancy was 63. You got Social Security at 65. Now, that's a very smart guy. Today, life expectancy is what, 84? I got 4 years to live? And you still get it in your 60s. Clearly, there are lots of reasons we have an arithmetic problem. We also increased the cap on wages. We raised it from the 83% it had been cut to in 1983, as a matter of fact. And we raised it to 90%, where it had been prior to 1983. And we had enough money left over in all of our plans that we came forward with to boost benefits for the truly disadvantaged. Our Medicare plan took an all-of-the-above approach. Some of the things you all talked today. We took this approach to slowing the growth underlying the increase in healthcare costs, which was growing at the time at a faster rate than GDP. We went after every sacred cow: doctors, lawyers, drug manufacturers, hospitals, insurance companies, and yes, even beneficiaries. Clearly, a yes vote on those proposals was not an easy vote for somebody running for public office. We gored everyone's ox. And the more we gored, the more support we got in our committee, the more bipartisan support we got in the committee. And because it actually restored solvency and solved the problems plaguing the programs, we ended up getting more broad support throughout the country because it was seen as fair. On this commission, a majority of the Republicans voted yes, as did a majority of the Democrats. In total, we had the support of a supermajority of the commission. But what made me feel so good, and what should make you feel good about the potential of getting something done, on the commission we had 6 sitting U.S. senators, 3 Republicans and 3 Democrats. 5 of those 6 voted yes for all of those reforms I just mentioned. How did they do it? How did we get it done? How did we bring these people together? In those 5 that voted yes, the philosophies couldn't have been more different. We had Tom Coburn. You remember Dr. No, the Republican senator from Oklahoma? He voted yes. You know who else voted yes? The liberal line, Dick Durbin, the senator from Illinois. And why did they do it? We took the time it takes to build up trust. And once we had built up trust, we were able to develop a common set of facts. And with trust and a common set of facts, you can almost get any deal done. It's how I've spent my life, both in the public and private sectors, getting deals done. I remember when Obama asked me to co-chair this commission, he wondered, how in the world, Erskine, did you bring Newt Gingrich and Bill Clinton together, who despised each other, and get them to agree on all the changes you had to make to balance the budget? We didn't have a commission. What I had to do was to spend months and months and months locked up in conference rooms with Newt Gingrich. And you all owe me a lot for that. And all during those meetings, he would test me. You know, he'd make a small concession to see if I'd go out and blab it to the press to win the day. And when we didn't, he said, maybe this Bill Clinton is serious. And I did the same to him. And over time, we developed trust. And with that trust, we could reach a common set of facts. Not Democrat facts or Republican facts, or what do they call it now? New facts or alternative facts. We developed the facts. And Obama was amazed because he said, look, I had these guys come up and play golf one time, and I had them come up for drinks one time. You know, I don't know why I can't get anything done. I said, because you have to work at it for a long period of time to build that trust. Trust is the corner of a realm. And that's how we ended up getting a majority of Republicans, a majority of Democrats, and a supermajority of the commission to vote yes. Over time, as Al and I crisscrossed the nation, we spoke to over 1 million Americans of all political persuasions. And as we traveled around, we began to feel the people's support. No matter who was in the audience, whether they were to the far right or far left, whether they were labor or business, at the end of our talk, they gave us a standing ovation. You know why? At least I can tell you why I think they did. They actually saw a Republican Democrat who truly liked each other. And secondly, we told them the truth. We didn't tell them just the good news. We told them the bad news and the things they'd have to swallow. And they really appreciated it. Al said he could feel and see, and Michael will appreciate this, could feel and see the American people's support as we went through various airports around the country. You could see it in their faces, he said, and you can see it in their hands as we got more thumbs up than middle fingers. Unfortunately, Congress never acted on most of our Social Security and Medicare recommendations, and now we've lost 15 years to inaction and fear. Fear of what those lobbyists will do to them and what the papers might say. Under our plan, we phased in most of the changes by 2050. That's a 40-year phase-in program. You know, we wanted to give people a chance to get ready. That's a joke. And we wanted to give them a chance to adjust. To make the math work today, we'd have to phase in over 10 years and probably even faster. I came in here today to stress we can get this done, but we are running out of time. We can still solve these enormous problems. We can't be afraid of the politics. When we first entered our negotiations between Clinton and Gingrich, nobody, including our own Secretary of the Treasury, Bob Rubin, believed we could get it done. But over time, we did build up that trust. Again, the key word. And we got 75% of the Democrats in the House and Senate to vote yes, and 75% of the Republicans in the House and Senate to vote yes. And when we did the bipartisan, what became Simpson-Bowles Commission, Al wanted to call it the Bowles-Simpson Commission. I said, Al, everything here is known by its initials. We don't want to be the BS commission. But when we began that again, nobody thought we could ever get the Republicans to support revenue increases. And nobody ever thought we could get the Democrats to support cuts. And we did, because we showed them the facts and they built up trust, trust being the corn of a realm. So that's why I came here today. I came here to tell you we can get this done. And I came here to ask you to lean on your organizations, ask you to support something like the committee's trust funds solution initiative. And I ask you to do it not because it's your job, but do it for the same reason that Dick Durbin and Tom Coburn voted for this 15 years ago. They did it simply because they came to understand that it was the right thing to do. So I'm going to keep working on this. I'm going to do it for the parents out there, for the neighbors, for our kids, for our grandkids. I'm going to do it for the country. Because if we don't, the price we'll pay is way, way too large. Thank you.
Thank you, everyone, for coming. We're so happy that you all joined us today, and we hope to see you at the next one.